Hi, my name is Dr. James McKenzie. I'm a chiropractor that specializes in neurology. Today I'm going to talk about dysthymia. So what is dysthymia? Dysthymia is also referred to as persistent depressive disorder. It's also referred to as double depression or depressive personality. Some of the risk factors include a loss of a parent, and also we see that if people have anxiety or substance use issues, they're more likely to end up with dysthymia. It's also often associated with personality disorders. So if a patient has, say, borderline personality disorder, they may also have this as well. Symptoms are much less likely to resolve in given periods of time than they are in major depression. So strangely, major depression is easier to help than dysthymia. So what do we see here? Depressed mood for most of the day, almost every day, for at least 2 years. And at least 2 of the following. So there'll also be issues with sleep and low self-esteem. So patients that have insomnia as well as depression. Interesting thing about major depression is that people tend to oversleep. They sleep way more than most people. So 6 to 8 hours is normal. These patients might sleep more than 8, like maybe 10 hours a day. These patients don't sleep enough. So during that 2-year period, the person has never been asymptomatic for more than 2 months at a time. So we know that this is one of the diagnostic criteria for dysthymia. And what is actually happening in the brain? We see that neurologically the frontal lobe doesn't work as well. And the frontal lobe, particularly areas 8, 9, 10, and 11 of the Brodmann areas, this is where our executive function is. This is where our ability to reason, interact with our environment, interact with people, make goals, follow through with our goals, get things done. This is where it all is. And so we see this issue with dysthymia. And what we especially see in the brain is decreased serotonin. And these are some things that actually we know that help with dysthymia. This is kind of the standard of care right now. So psychotherapy, there's 4 different kinds of psychotherapy that we know are helpful. But these are mostly supportive care, meaning that they don't cause a long-term change. What they do is they help manage the problem. So supportive therapy, psychodynamic therapy, cognitive behavior therapy, and interpersonal therapy. We also see that selective serotonin reuptake inhibitors, those are the medications that work, as well as tricyclic antidepressants. They work. But the reason why SSRIs work is because they're trying to recycle the little bit of serotonin that the brain actually has. The brain doesn't have enough serotonin, so it's trying to recycle it. But the problem with these kinds of medications is that there are side effects and adverse reactions. With SSRIs, oftentimes we see weight gain, which leads to lots of other health problems. So how can brain rehab actually help? What we would do at our clinic, of course, we would get a very good history, and we would look at labs, and we would make sure that that we have the ability to rehab the brain. Because if patients have blood sugar issues, or if they have anemias, or they have underlying infections, or they're not drinking water, or they have different kind of metabolic things that are going on, we need to find those things out, so that way we can be resolving those things while we're trying to rehab the brain. Otherwise, the brain doesn't get rehabbed. But we can figure out, we can quantify the dysthymia using CNS vital signs, which even the Mayo Clinic uses. But it's a very good way to figure out, is it mild, is it moderate, is it severe? And we can do that before we start care, and we can do it as a follow-up to measure change. We can also localize the areas of the brain that are either overactive or underactive, and we use a quantitative EEG to do that. So we hook you up to electrodes, and and we actually look at brainwave activity. And when we look at that activity, we can tell which areas are working too hard, which areas are not working hard enough. The problem with things that are underworking or overworking is the same, and that is that those areas are degenerating. Because we don't want underactive nerve activity or overactive nerve activity. So we can use something called neurofeedback to dampen the areas that are working too hard, and we can also use it to take the areas that are not working hard enough and increase their activity. Then we also, our goal would be to give the appropriate supplements. In this case, we'd probably give you a supplement that would help your brain make its own serotonin. So if obviously you're not making enough, then there's things that we can do to increase the ability of the brain to actually do that. We'd also try to give you possibly something to also nourish the brain so that the brain has what it needs so that it can create long-term change when we start doing things to exercise the brain so that your changes are long-lasting rather than just short-lived. And we also have special interactive somatic exercises that stimulate the appropriate areas of the brain, and we can measure and quantify the improvement on that as a patient is going through care. We also have special home exercises that we give the patient to balance out the two sides of the brain, as well as constantly exercising those areas and stimulating those areas so that in between treatments the patient doesn't go backwards at all. We want to make sure that we're continuing to make gains with our care and with the progress for the patient. And you know, with any kind of mood disorder or with personality disorder or with any form of psychosis, recommendation is to, of course, have your psychotherapist and have them on board with the care. So we are willing to work with them synergistically for the sake of the patient. And what we also do is pre and post testing to make sure that we're causing a long-term change. We call that long-term potentiation, where we create a long-lasting change in the brain. So basically, as a clinician, my goal is just to change the function of your brain and to make it as good as it can actually be so that you can have the best quality of life, and life is a lot more enjoyable that way. This is the contact information, so if you wanted to schedule an appointment or ask any questions or have a consultation, we can set that all up. All right, thanks. Have a great day.